Welcome everyone. I'm Dr. Natasha Iyer from Calgary, Alberta. Today I want to share with you a miracle, a gift from nature, something that we should have been using in medicine for many, many years. I am a conventional medical doctor, having started out with a rural emergency position. And I've spent 25 years now working with patients and helping them find solutions when other aspects of medical care don't quite give them the answers they're looking for or the solutions that they're looking for. Let's put it that way. So my practice today is based in a field called functional and regenerative medicine. We look for the most natural solutions to restore the body back to its best function. So if you think about a headache, for example, if someone goes to me when I was a family doctor, I might give them a prescription for a painkiller, a headache pill or something like that. Today in functional medicine, I would say, what is the root cause of your headache? Is it an electrolyte disturbance? Is it a food sensitivity? Is it leaky gut? Is there some imbalance in your body where when I fix that, things will get better and the symptom of the headache will go away? So that's what functional medicine is, and I love it. I use a lot of diet and lifestyle and nutritional interventions, supplements, and medical cannabis has been a game changer for many patients in my practice. And I was reviewing the results and seeing what amazing results we're getting with something that has a very, very low rate of addiction, has no possible overdose and death as a result from it. And when you think about the opioid crisis right now, when you think about all of the people who have chronic pain, really narcotics seem to be the final solution or the final frontier for people, and they get dependent on medication. So in addition to functional medicine principles, I have found a really beautiful space for the use of medical cannabis, and I wanted to talk about that with you today. Cannabis has been used for many, many thousands of years. It's interesting that 8,000 years BC, it was discovered in Asian archaeology. In the Middle Ages, it was used for hemp sails and rope for navy. And that's the nice thing about this plant. It has medical constituents, but so many other environmentally friendly uses that could replace much of what we're doing today with synthetic plastics that destroy the earth as well. I just wanted to mention that about 5,000 years ago, the Chinese were found to use cannabis for pain and cramping. So it's been used for that long. Now, what's the difference between hemp and marijuana? You can see that they look pretty much the same, except that the hemp plant has less than 0.3% THC. I'm going to explain this to you later. Marijuana has more than 0.3% THC. Oops, the wrong way. So here it is, cannabis sativa. Now, I just want to mention something, like with roses, and I don't know the Latin names and all of the classifications, but you know that you have a rose plant, and then there's multiple different kinds where the flowers might be bigger, smaller, single leaf, multiple petals, single petal, multiple petals, different colors, different fragrances. Even the leaf sizes will look slightly different, but they all resemble each other, right? And so they have a main species and then they have a subspecies. So it's the same thing with any plant family, any tree, anything like that. But here we go. The actual name of this plant is called cannabis sativa. It contains things called phytocannabinoids. They're plant cannabinoids, right? And so phyto is anything plant derived. CBD stands for cannabidiol. Its most important benefits that we use it for, amongst others, because there are others, is anti-anxiety, anti-inflammatory. including autoimmune for use in autoimmune disease. It's analgesic, so it solves pain. It's antipsychotic, anticonvulsant. So there are children who are having 300-400 seizures a month who are now seizure-free using medical cannabis. So it can be critical for some people for their health. When you think about all of the drugs that these children were taking and having not too many results from it, or not enough result. So life can change. Life can absolutely change with this plant derivatives. Neuroprotective, meaning it protects the cells of your brain. I think that's pretty amazing because I want a healthy, happy brain for all of my life. I don't want to lose any of my brain power. Now, I'll say this much. There's no one thing that solves everything. I'm not going to say to you, take cannabis purely to protect your brain. We know that things like diet, lifestyle, how much you sleep. Sleep is so critical for brain protection. When you're sleep deprived, you are at higher risk for dementia, for cancer, for heart disease, for high blood pressure. So many things interact in the human body. And I don't want you to listen to this excuse me, this presentation thinking that here I am saying that cannabis is the only thing you need to do. I believe that it's a part of a healthy lifestyle and healthy living program. So THC, tetrahydrocannabinol. So you see why I like abbreviations, because I really cannot quite get out cannabidiol and tetrahydrocannabinol very easily. So THC helps with pain, emotions, thought processes, immune system function, and in balancing brain chemistry. So you may have some information or have heard of, but I'm going to educate you from the basics moving forward, that there are cannabis, and people talk about indica, they talk about sativa. So I wanted to go into that. So you have the plant, and you have sort of a strain, and they call them cultivars. And so the subspecies of cannabis sativa is cannabis sativa indica, or cannabis sativa sativa. And then there's this third one called cannabis sativa ruderalis, which is very high in CBD and almost no THC. So what is it about indica and sativa that you need to know? You can have a CBD oil, for example, that is indica derived or derived from the indica strain, but it is CBD and hence not psychoactive. So don't confuse the indica and sativa with the psychoactive or the ability to get high on it, okay? So indica is known for more of a promoting of relaxation, sedation, and you can have psychoactive effects from it. Sativa is supposed to be creativity, uplifting, and psychoactive components as well. It's the difference between CBD and THC that we need to distinguish when we're talking about sedating and psychoactivity. I hope that was clear. I feel like I confused you more. Anyway, when we're talking about picking a strain, you can have CBD as a blend, so it can have some indica and some sativa in it, and it is not psychoactive. So CBD is it can be taken during the day, it can be taken anytime, it doesn't impair your thoughts, it doesn't impair your reality, it does not have any psychoactive effects. That's CBD. THC, on the other hand, is the psychoactive component, and it will make you sleepy, it can make you happy, but it will impair you, and we do not recommend that you drive when you're using THC. I'm going to just let you know that I don't recommend people take just THC or just CBD. We use them both. It's something called the entourage effect. So basically, I'm going to teach you about the receptors and things, but it's the combination of both molecules that give you the best results long term. And I'll talk to you more about how to take it and all of that. I want to mention terpenes. So terpenes are natural compounds responsible for a plant's color, smell, and flavor. What's interesting about cannabis, the plant cannabis, is that different strains have different amounts and components of terpenes. So for example, there's a terpene called myrcene, limonene, pinene, beta-caryophyllene. And there are more. I've just picked the most common ones. So sometimes when you're online, and I refer patients to pharmacies that deliver and their products are listed online privately, you will see things like high in limonene and pinene as the terpene profile. So when you're looking at that, these are the things that they sort of enhance. So myrcene for analgesia and sedation. Limonene is an antidepressant and it's immune stimulating. Pinene increases acetylcholine, which is really important brain chemical. We know that in Alzheimer's disease, acetylcholine is deficient. I'm not saying that this will help prevent Alzheimer's disease. The research is not there yet. However, here we have a plant ingredient that has been shown to improve acetylcholine levels in your brain. And what acetylcholine does is also help you with quick thinking and memory. So it's not a bad thing to have, right? Which has anti-inflammatory and analgesic effects. And we know that it helps on this particular receptor that I'm going to teach you about called CB2. So the cannabinoids are THC and CBD, and they work together with terpenes, and all put together, we get an entourage effect, which means synergy. Now, I explain synergy like this. 1 + 1 can give you 2. Or 1 + 1 could give you 5. How does that work? Synergy. So when you take these two things and put them together, your net benefit is more than the benefit of each one alone. It's not additive, it's synergistic. So just some plant drawings, and people will talk to you about the female flower, the male flower. I'm not too interested in going into the details, but suffice to say that there's these things called trichomes on the female flower, and see, it's these tiny little dots right here. That is where you get the CBD and the THC extracted from. I just thought it would be interesting to see. And here's another picture where you can see the trichomes. And they come from the female flower. And this is what it looks like when they're growing it. I'm really particular about where I direct patients to go to obtain their medical cannabis. The reason being, this looks great, looks like a little farm indoors. In the old days, they called them grow ops. Anyway, this is a proper facility that manufactures, and the standards are very, very specific for medical grade marijuana. All of the requirements have to be met as if you're producing a medication, which is far higher than even producing a vitamin by the standards that have been set out. So in these controlled environments, as you can see here, the light is controlled, the temperature and humidity is controlled. But what's really nice about this is there isn't much of a need for pesticides and herbicides, right? Because this is a very specific horticultural process. We don't want to refer you to any place that uses chemicals and things to enhance the production and the amount that they can produce, because that's possible. We don't want any herbicides or pesticides used. We want it to be completely organic in nature without contaminants. And to me, as a functional medicine doctor, that would be one of the most important things, that I I'm really particular. I tell my patients, look at the dirty dozen. Try to avoid those foods because they're the highest in contaminants with pesticides and herbicides. So we want to eat more organic when it comes to those foods. We talk about the clean 15. We talk about lowering toxic burden. For all of you on my private coaching program, you're going through that with me right now, where we're lowering the toxic burden. We're starting to look at our homes and everything that we expose ourselves to. So why would we want to expose ourselves to chemicals that actually would be quite concentrated? Because I showed you that we're getting everything from these tiny little dots here. So if they're extracting CBD and THC just from these dots, how concentrated a solution must it be? And if everything is sprayed or sprayed with any kind of substance, whether it's to enhance its growth and its concentration or whatever the chemical is, it's going to be really concentrated into the oil that we're recommending. So that is why I like to know, where does the product come from? How is it produced? Is it cold expressed? Is the chemical processing of this using other solvents and chemicals? Because we know that even in the production of certain supplements, for example, omega-3 fatty acids. So we all think it's just fish oil. Well, the fish could come from high lead and mercury burden. The oil can come from fish that are high in lead and mercury. When you're extracting the oil from the fish, you're getting lead and mercury into that oil that's going into the capsule, and you're swallowing it. It's concentrated, right? We also know that certain companies use solvents, chemical solvents, which are quite toxic to you, but they're using chemical solvents to extract the fish oil. We know the same thing to be true for plants. You can use chemical solvents to extract the ingredients you're looking for, or you could use carbon dioxide or certain other very natural, very clean methods to extract the ingredients that we're looking for. And that, I think, is really, really important. We know for sure that the company, even though it might meet the pharmaceutical grade, the drug production grade, it might use a solvent. So I want to send you to places where I know they're not adding or using solvents in the extraction, so that it's a really clean and safe product. So the cannabis plant contains over 100 active compounds. I'm just reading that thinking, that doesn't make any sense. So yes, the cannabis plant contains over 100 active compounds. As I mentioned, THC and CBD are the most abundant and the best studied. When we combine the two, that's when we get most of the benefits of medical cannabis. Now, I want you to know that THC and CBD act quite differently. CB1 receptors and CB2 receptors have a particular affinity for THC. This is your psychoactive component. So we know, if I use lay terms, we're going to say it's going to make you high. It's going to impair you. It's going to make you feel drunk at certain doses. However, you do not need to achieve a state of feeling intoxicated to get the medical benefits. And I'll say that again. You do not need to take as much as it takes to get intoxicated to receive the benefits, the medical benefits that we're looking for. What that means is, if I'm using an oil and I take this much of oil every day and I feel nothing, or I take that much of oil, double the, let's say even a slightly bit more every day, and this makes me feel intoxicated, I would go back down to the dose that doesn't make me feel intoxicated and stay there, because I'm getting all of the benefits without intoxication. I'm going to take a pause here and say something. I do not judge people who want to use medical cannabis for medical reasons and for recreational reasons too. So when we talk about recreational cannabis, we're talking about people who are using it purely for the intoxication that comes with it, purely for that feeling of being high. I have some patients who say to me, when I take the sativa of this type of product, I feel so creative and I'm in my zone and I feel amazing and I'm so relaxed and I'm just a little bit buzzed. Well, you can get all of the creativity and all of those lovely benefits with slightly less, so you don't have to have the buzz. And if you do want to have the buzz or feel intoxicated or feel high, I'm not going to judge you, because to me, no one has died from medical marijuana. Many hundreds and hundreds of thousands of people have died from alcohol. Many, many hundreds of thousands of people have died from opioids. So I help my patients with it medically. I encourage them to use the minimum dose for the maximum benefit. But should anyone wish to try a little extra at certain times, I am okay with that. I don't promote it, but I do not reprimand you for it. So I think I just want to be clear about that. Oh, this is just some fancy diagram to show you that it helps with the transmission of substances from a cell, from the cell to the receptor site. And what it means is that it's been well studied enough that we know how it works in the nervous system. So this is just a guide. You can see that there's CB1 and CB2 receptors in the whole entire body, with a predilection for around the gut. Now, what's important about the gut? For all of you who are regular followers of me and you're into the functional medicine paradigm and you understand this, what do I say? Everything starts in the gut. Your gut health is primary for your overall health, right? And more than 70% of your immune system is in your gut. So when we're looking at some of the miracle benefits of medical cannabis, it has to do with this propensity of receptors in the gut and around the immune system. There are anecdotal cases of cannabis reversing cancer. A lot of people say it's anti-cancer. Now, as a physician, I can mention anecdotal. I can tell you that the studies are not out yet, but all over the world, this is a field that is exploding with information as more and more, now that it's legal, more and more people are able to study. So the researchers are finding out details about little sub-molecules of the cannabis plant that have different effects. For example, there was one recently, a paper was written about that helps with pancreatic cancer. And we know that it helps the immune system. We know that it helps with autoimmune disease. So, as far as saying take cannabis if you have cancer or to prevent cancer, with anecdotal evidence and cases that have been reported, absolutely, it can play a role. I'm not saying it's the only thing that's going to solve your autoimmune disease or your cancer or solve your risk for cancer, but I'm saying it is a wonderful addition to your armamentarium and your lifestyle and everything that you're doing to be healthy long term. Now, up here, we can see that there's a lot of receptors in the brain. I love medical marijuana for PTSD, so post-traumatic stress disorder. I have seen incredible turnaround in patients where we're struggling. See, in functional medicine, I have a model that I present to patients, and I talk about, patients come and see me because of my interest, my special interest in bioidentical hormones. And I teach them that hormones aren't the be all and end all. Yes, they're the chemistry of life. But in order for hormones to work optimally, we need a clean and clear and optimal biochemistry. We need an optimal nutrient reserve stores availability for that system to come together and work for hormone balance. At the same time, there's the mental, emotional, spiritual aspect of health that is completely interacting with the hormonal and biochemical environment in your body. And when you have stress, you're changing your biochemistry, you're changing your nutrient stores, you're changing your hormones. And it's very hard to get balance in someone when we're constantly under stress. And a lot of people will say, I have no stress. I have a happy marriage, I have a good job. Well, outside of the COVID pandemic, of course, but people say, but I'm happy. And as I work with them, I go, but there's something else going on. And then you find all these things that happened in childhood. And, a lot of us, we'll say, my childhood and what I went through before defines who I am. And it helps me be, the wonderful person that I am, the well-adjusted, I can look at life differently. I agree with that. But I also know that healing past trauma is a lifelong journey. And for some, way more, well, I would say for most people, way more difficult than taking something. What I have found is that when we use medical cannabis with the THC component, therapy, whatever conscious work that patients are doing, whatever personal development work, it works better because they're calmer. And I don't know if I put the study in here, but I was reading a study last week about one of the chemical components of THC and how it acts between the amygdala and the frontal cortex of the brain. And it was describing how that relationship between the amygdala and the frontal cortex is impaired with anxiety. And that when we use CBD and THC, we can actually improve that. So imagine someone who's anxious all the time and there's a constant stress on the body and it's a constant stress on the entire system of who you are. And if we can calm and settle that stress and that stress response, how much better your life and your health will be. So, I wish I had like a whiteboard and I was drawing things for you, but hopefully that made a little bit of sense. But again, I love the impact on the brain and the brain chemistry. And it's so simple. It's just a tiny little drop of oil that's giving us these benefits with no addictive potential. Unlike Valium and Ativan and all these benzodiazepines is the class of medication. They're very addictive. We know that it interferes with your memory over the long term. Some people take a benzodiazepine, so an Ativan, and lose memory. It happened to me. I had a dental procedure. I was so anxious, and I took an Ativan. I lost 3 days of memory. So I would never take that again. So now there's a natural substance created by God or Mother Nature, however you believe. And this substance can help you with anxiety and to lower your stress and your anxiety with no long-term effects. So you can stop it at any time if you choose. And I think we covered this, that THC stimulates CB1 and CB2 receptors, and the actions in the brain involve the CB1 receptors. And it activates CB2. Why have I repeated myself? This is an interesting thing. So cytokines are molecules involved in inflammation. So you have a substance called THC that inhibits the release of inflammatory molecules in your body. This is how it helps lower pain and inflammation. And so there it is, anti-inflammatory and immune system effects. And it should be immune enhancing effects. So CBD does not act via the endocannabinoid system. And we define that system by CB1 and CB2 receptors. 2-AG is actually a very interesting molecule. So anandamide, Ananda in Sanskrit, so from ancient Indian philosophy, Ananda is the state of divine peace. And they've named that molecule anandamide because it causes that state of peace. So it's quite an interesting name I thought I'd share with you. But back to CBD, it does not activate CB1 or CB2. It works by a distant other effect. It may interact with the endocannabinoid system indirectly, but it works on its own separately. And this is why I always recommend we combine both. See, God didn't make that plant on its own just with CBD and a different plant with THC and a different plant. You know, everything is in that plant together. And so for me, when I look at things and I just go, well, why did God in all of his wisdom put it all together? Maybe we're supposed to get it all together for the benefits. And isn't it interesting that we have an endocannabinoid system, and the molecules that work on that system come from a plant? Food for thought, hey? THC partially activates CB1 receptors all over the brain. And if you go back to that picture I showed you, and I'm actually just going to take you back there. I apologize for this. You know, when you see these receptors all over the peripheral body, what I want to point out to you is that people with chronic pain, people with muscle tension, fibromyalgia, we find that they have wonderful release. There's scientific data about spasticity, muscle tension. So we know that it helps, and that's what I love, is that you can get a whole body relaxation and you can get a mental relaxation if that's what we're looking for. And again, we pick the strain, the cultivar, and then the terpene profile based on all of these things. So here I'm just summarizing for you. The hippocampus is really important for memory. And we find that under high stress, the hippocampus shrinks. So think of those children that have been abused or molested or emotional, physical abuse. Think of the teenagers, the young adults, the older adult, everyone. Just think of people who have huge trauma and then they have other stresses as well. What's happening to their hippocampus? Their memory is just not going to be good anymore. And what we love is to do treatments and use molecules that can help reverse this injury to and the shrinking of the hippocampus. Cannabis and cancer. So we've seen through scientific studies that medical cannabis and certain ingredients from it have a cytotoxic effect, meaning cytocell, toxic, kills it. So we have something that can kill cancer cells and yet has a cytopreservative effect on normal cells, meaning it leaves the normal cells alone. Now, cross-reference this to chemotherapy. Why do you get hair loss? Why do you get nail changes? Why do you lose your eyebrows? Because the chemotherapy is not specific to a cancer cell. It's to all that are actively dividing in your body. So your hair cells are actively dividing and they get killed. So yes, more studies are needed. And the current recommendation is to use cannabis in conjunction with conventional chemotherapy or radiation, whatever your program is if you have cancer, until more studies are done. So I certainly don't say to anyone, oh, just take some medical marijuana, it's going to cure your cancer and you're going to be fine. No. Use it in addition to whatever else you're choosing to do. And that includes diet and lifestyle and certain nutrients that we know help. High dose vitamin C is an example. I wouldn't say to someone, just do medical cannabis. I would say, do high dose vitamin C. There's enough scientific proof that that works, like chemotherapy. And I know a patient right now who has been using medical marijuana, and she has pancreatic cancer, was diagnosed in about the middle of 2019. And I have to tell you, you know, for her, it's not just lifestyle, but it's her positive mindset and the medical cannabis. And she's still with us when she was probably given just about 6 months, and we're into, heck, we're just 2 months away from a year. So good going. And this is just here because, you know, in the media and in most physician offices, this is the crisis. And I'll tell you this as an emergency room physician, which I still do. Cannabis does not affect the respiratory center of the brain. So we have something called the brainstem, and alcohol and opioids affect that breathing center, and they cause what we call respiratory depression. And I have seen people come in almost dead from opioids. And fortunately, we have the antidote for the opioid. But if these patients had not started using opioids for pain, if they had had medical marijuana for pain and had good control of pain that way, we wouldn't have these things coming into the ER, these situations where people are almost dead. And sometimes it's from abuse, like drug abuse, but sometimes it's a patient in pain just trying to get rid of the pain and taking more. So we're not going to judge anyone that's using opioids and say, oh, every one of them is an addict. And, you know, it's not necessarily true. So I just wanted to say that. Are there drug interactions that we should be wary of? And so I just explained this. There's no central nervous system, CNS, respiratory depression. It is theoretically possible because, and so for all of you who follow me in my functional medicine practice, who are patients and actively working with me, I talked to you about the cytochrome enzyme system. So the cytochrome P450 enzyme system has multiple components within the liver. They're controlled by genetics and regulated and by genetics. But what this does is it allows you to process out things. Like, for example, if any of you have ever had a statin drug prescription for high cholesterol, they tell you not to take it with grapefruit. Why? Because grapefruit goes through the same enzyme system and the drug goes through the same enzyme system. And basically, when we talk about drug-drug interactions, what we know is that one thing might turn it on, and then you'll metabolize the other drug faster and you need to change that dose, or it might slow it down or turn it off, and then that drug is just in your system for way longer than it should be. And some drugs just don't go well together. They'll give you a serious side effect. So that's what we're talking about. When we say drug-drug interactions, it's how are they going through the cytochrome enzyme system, and how do they affect each other, and are you going to have some significant side effect? So you would think that because everything goes through your liver, so whether you take a Tylenol, whether you breathe in some paint fumes, whether you're filling gas and breathing in the gasoline fumes, if you're cleaning your house with Mr. Clean or bleach, if you eat food that has been sprayed with glyphosate and pesticides and chemicals, if you eat food that has preservatives and colorants and all kinds of additives and things like that in it, no matter what you put into your body, it goes through your liver, and it goes through the same cytochrome P450 enzyme system. So the terpenes, the CBD, the THC also go through your liver. Smoking, if you smoke a cigarette, not just nicotine, but all those hundreds of awful molecules created by combustion go through your liver. Well, they go through your lung as well, and then your liver. So you can see how your liver is really busy, and these enzyme systems are really working hard with all the things going through it. And yet, after hundreds and hundreds of thousands of people illegally experimenting and recreationally using cannabis for the last, 100 years, they're taking medications, but nobody comes in with side effects from a drug-drug interaction. So we don't know enough about this, and that's why it says it's theoretically possible, but we haven't seen any drug-drug interactions except clobazam, right? And so this is in the same family as the drugs I mentioned earlier. CBD at high doses with clobazam has been shown to have sedating metabolites circulating, and your level of sedation is higher, which is not a good thing because benzodiazepines can affect the respiratory center in the brain as well, and you can overdose and die from benzodiazepines. And then now comes all of this stuff on the details, right? I get a lot of questions about THC and what it does and how it does it and what do you have to worry about and all of those sorts of things. So I've tried to summarize for you a little bit of the most common questions that I get. Medical marijuana, I brought you a little bottle. This is how it looks. I'm wondering if you guys can see me because I have no view of myself. But it comes in a bottle and I don't have a syringe here. So I'm going to just use a pen and pretend this is a syringe, right? And it's an oil. So this particular, and this is just a sample bottle, there's nothing in it. But we're going to pretend that it has oil. And this particular oil is a sativa THC product. So sativa, theoretically, I recommend sativa for daytime use. Sativa doesn't have to be taken in doses that will give you psychoactive effects, but the doses can be taken where you get the medical benefits, as I've said already. So because it's a sativa strain, this one can be taken in the afternoon. It could be taken on a Saturday morning. Because of the psychoactivity, as a medical doctor, I have to tell you, if you're using this, do not drive for 8 hours after you've taken your last dose, minimum, okay? So here we have a sativa strain. It is THC, and there's 23.5 milligrams per mil. Okay, so if you filled a 1 ml syringe, it would have 23.5 milligrams. If we made this into a capsule, then there'd be 23.5 milligrams in a capsule. And that is a very high dose. So because there's 23.5 milligrams in 1 ml, I have patients start very low. I say to them, measure out 0.5, oh, sorry, that's way too high, 0.1 milliliters. So it's the first line on the syringe. 0.1, start your first night, take it an hour and a half to 2 hours before bedtime and see what happens. Chances are nothing's going to happen because it's about 2 milligrams that you're getting, 2.35 milligrams. So your next night, you would take more. You would take 0.2 milliliters and you would see what happens. Nothing happens? Great. Go to bed anyway. Your third night, you go to 0.3 mils. Your fourth night, you try 0.4 mils. Your fifth night, you try 0.5 mils, which is half a syringe, okay? At some dose, whether it's 0.3, 0.5, 0.8, 1.0, a full syringe, at some point, 90 minutes later, 1.5 hours later to 2 hours later, you will start to feel a little different. You will feel dizzy, you might feel lightheaded, you might feel slightly sleepy or extremely sleepy, and you might feel high. So if any of those things happen, then that dose is the maximum for you, and your actual dose would be slightly less. So assume at 0.5 mils, you got extremely sleepy, but nothing else. And then at 0.6 mils, you got high, or you got dizzy, or you got something that didn't feel normal. Because if we're using it for sleep, then 0.5 is your dose. If you're using it recreationally, 0.6 is your dose, right? But what we will do is we'll take you up very slowly until that point that you have the effects that we don't always want, and then we'll back down to the dose before. Does that make sense? So with THC, have no fear, because we call it microdosing. That's what I call it. I wish I could find the syringe I had placed here. But anyway, it's microdosing because we're going in such tiny increments, up and up and up, until we know we've got a good effect. And beyond that, we have some side effects. Well, some people don't call being high a side effect or feeling intoxicated, but, you know, and so from that intoxicated point, we back down, and that's the dose. That's your THC. I do CBD slightly higher dosing off the bat because it is not psychoactive. It does not intoxicate you. There are no long-term effects. It's been studied at 6,000 milligrams in 24 hours, and no one's died from it. And here we are at 20 milligrams, right, per dose. And I typically find that patients will actually do just fine between 5 to 12 milligrams of THC. It just depends on metabolism, and that's the other point. No two people take the same dose. No two people react the same. You know, my husband can drink a pot of coffee before bed and have a good sleep. So he's a rapid metabolizer. He's the guy that takes double or triple the Tylenol dose because the regular dose doesn't work for him. And so the first night I wanted him to try THC, I take 0.3 milligrams, and you know, that's my dose. I don't feel anything at 0.3. I can wake up in the middle of the night. I could do anything I do in the daytime, and I am absolutely fine at 0.3. So I gave him a full milliliter, thinking, well, you know, I mean, I drink half a cup of coffee in the morning at 9 o'clock, and I'll be awake for a day and a half. I will have the worst sleep possible because I'm such a poor metabolizer of caffeine. And so just for some reason, I gave him a mill without starting low and going slow. And the poor guy was knocked out the next day. He was dizzy. He did not feel good for an entire 24 hours. So case in point, do what I say, not what I do. And just always start low and go slow. CBD actually lowers the intoxicating effect. So it cancels out some of the intoxicating effects of THC. So I always recommend to my patients, take some CBD with your THC for your nighttime dose. CBD, I dose a little bit more freely because, like I said, you cannot overdose on it. You cannot overdose on THC either, but the THC can make you vomit. It can make you shaky. It can drop your blood pressure. It can raise your heart rate. So these are not things that are nice to feel, right? But with CBD, you will have no effect. But the benefits are huge, right? So we have benefits for pain and anxiety and mood and all of those things. So we start with 0.25 to 0.5 mils of CBD per day, once or twice a day. I prefer twice a day dosing. And what I say to patients is give it a trial for 5 days before you change. So you start, say you have an aching hip joint, right? So you have pain and you know where it is. So you take your 0.25 milliliters of CBD twice a day and you wait 5 days. Some result? Great. No result? Go up to 0.5. Now, the dosing, I start this low because most of my patients, most people who see me for medical marijuana have never used it before. Okay, and so when you've never used it before, you want to start really low. But if you have tried smoking it, vaping it, or whatever, if and I don't agree with any of those administrations at this point. The only thing I use are oils. I know people have an issue with the oils because of the taste. You eventually get used to it, or you could mix it with something. But I like the oils because they allow us micro dosing. As opposed to a capsule, it's a fixed dose. So if there's 20 milligrams in a capsule, then how am I going to give you 5 milligrams? Okay, so they do come in 2.5 and 5 milligram capsules, but those are dispensary quality, and I'll talk to you about dispensary quality as well. I have to write a note to myself to remember. So the lower doses, the lower concentrations are more likely to be found in the dispensary, and the pharmaceutical grade medical cannabis from your licensed producer is usually much higher concentration. So concentration is sort of let's say 10 milligrams in 1 mil versus 20 milligrams in 1 mil, or 5 milligrams in 1 capsule and 15 milligrams in a capsule, right? And so if you've used marijuana before, you maybe don't want to start at 0.25 of CBD. You maybe want to start at 0.5. And for your THC, if you've smoked it before or experienced it or eaten a brownie of it, or a gummy or whatever it is that they have out there, and you know that you tolerate it, then you can start at 0.25 mils instead of 0.1 on your first night. I still recommend you go with low, and I'll caution you, if on that first night, say you started with 0.2 milliliters of THC and nothing happens 2 hours later, I do not recommend that you take another 0.1 or another 0.2 mils. Just forget about it for that night. Wait until the next night and just increase properly and watch the metabolism. The metabolism of THC and CBD as oils is affected by whether you're eating or not eating. I'll mention that these are fat-soluble compounds, so they don't do well in water. That's why they're made in an oil. Being fat-soluble, we do recommend that you take it with a fatty snack like some nuts or some cheese or a spoon of nut butter, or when you're eating your steak at night. But then that might be a bit too close to bed, too far away from bedtime, and so but we do recommend that. I personally don't, because I stop eating at a certain time because I practice time restricted feeding or time restricted eating, and so I take mine on an empty stomach, and I've learned to dose my dosing reflects taking on an empty stomach, meaning that the absorption's different. So if you're used to dosing on an empty stomach, for example, be very careful for the day that you have a late night snack and then you take it, because your absorption is going to be enhanced and your effects are going to be enhanced. So if you're eating late at night, and okay, if you always eat late at night and you always take your CBD and THC at that point, no problem. But if you always take it on an empty stomach and then this night you went out to a party and you ate late and then you take it, that dose might slam you. So you may want to decrease it, but this is the trial and error. The thing about this is nobody knows what the dose is, and everybody's dosing is different. Some people, through their titrating, that's what we call it when we say increase gradually each time, it's called titrating up. Each person finds a different dose of CBD that gets them their anti-anxiety and anti-inflammatory, anti-pain effects, and different doses of the THC for their sleep and their overall relaxation and their pain and their mood and all the other benefits that it gives you. So CBD balances THC side effects, and that's why I like you to take them both. And I'd like it in a 1-to-1 or a 2-to-1 ratio of CBD to THC, sometimes higher. That we discuss in your consultation and when we're figuring out what's going to work for you. We do not get tolerance to the benefits. So as opposed to, say, let's take alcohol, because that's the most common, or an opioid. We know that people develop tolerance, so the same dose stops working. And then you need more, and then you need more, because your body just gets too used to this, right? Or there's some medical terms that I won't share right now. But let's put it this way. You do not get a tolerance to the benefits. So your anxiety, your sleep, your pain, your PTSD, your brain chemistry, none of these get too used to that dose, and eventually you need more and more and more. You do not get that, okay? Now the driving, I'm talking specifically about THC. Okay, and I kind of mixed them up now because this says THC up top and I've been talking about CBD, sorry. So if you take THC at bedtime, you may not drive for 8 hours after. And if you're a very slow metabolizer, then you should not drive for 10 hours after. And I want to mention at this point, I want to talk about smoking versus vaping versus edibles, baking it, making brownies, making butter. Anytime you heat this, you are changing it, okay? In the oil, it's extracted, it's measured, we know what you're getting. If you took, and I don't have anything that looks like an herb, because, just imagine, right? I think the dried cannabis flower looks a bit like some kind of herb you'd have in your kitchen, I guess like oregano or parsley or something. If you take that and then you cook it, so you make a brownie batter or a cake and you put the stuff in it, the heat is changing it. And then how big a bite are you going to take and how much is there per bite? I have no idea. So again, if you want to do that recreationally, you go right ahead. But I cannot recommend it medically because I have no way to dose it. So I give you 5 grams of dried flour and you bake a cake. Well, then how much did it mix evenly? And how much per bite? How much per slice? How much? I don't know. Okay. And then when you're smoking it, you burn it. So you change some of the molecules. You're creating undesirable molecules. We talk about advanced glycated end products and the fact that when you're burning and heating something above a certain level, like cigarettes even, right? So the impact on the body is negative. So when you're smoking it, well, say I'm going to take a breath in. Okay, am I going to breathe in the same amount of vapor, or yeah, I'll call it vapor, from to use a layperson's term, joint? So I'm going to breathe in from a joint or a bong, and I'm going to go, well, how much did I get? And then do I take 3 breaths? Do I take 5 breaths? I don't know. But is every breath going to be the same? Is every depth of inhalation and how long I hold it and how, there's so many variables when you're smoking it that I would recommend you not smoke it. It's not good for your lungs. It's certainly not good for patients with asthma and obstructive airways disease or anything going on in there. And I don't like burning things and inhaling them. I just think it is so unhealthy. Again, you want to eat a gummy? Go eat a gummy and be happy and high. That is fine if that's what you wish. But I, as a doctor, don't know how to dose you for your anxiety and your PTSD and your pain and your inflammatory bowel disease and your, whatever other condition we're trying to treat. And the list is endless. It helps menopause symptoms. It helps headaches. It helps migraines. It helps appetite. It helps nausea, and people who have, unknown nausea, like causes for nausea. So again, I like something that's precise and specific. And I'm a traditionally trained doctor. I was trained writing prescriptions and doses, and that's what I know and that's what I like. Even if I gave you omega-3 fatty acids, I'm going to recommend 3,000 milligrams per day in divided doses to protect your cholesterol levels or to help you try and lower your cholesterol levels. I'm not going to say go just take it, right? Because that's what a doctor does. And for me in particular, I want to know dosing. So again, I like the oils because I can microdose with that. And then I get a lot of questions. Oh my, I'm almost out of time here. I get a lot of questions about travel. Travel is a very interesting thing. So you may not travel outside of Canada with your medical marijuana. You're free to travel all across the country with it. The processing of a prescription looks like this. I register you with the College of Physicians and Surgeons because it is medical. And I think it just stops patients from getting more and more. I have this theory, and I don't know if it's true, but I said this to a patient. With medical marijuana being so much cheaper than what you can buy at the corner store that's selling cannabis, your budster, bud tender is helping you purchase, those are about 30, 40, 50% more, like almost double sometimes in price for the same product. And I'll just say this very quickly. I had a little lady come in, little lady, she's 72 years old, and I gave her this little presentation on medical marijuana, and she's got pain and she's got inflammation. And in functional medicine, I measure levels of inflammation. We couldn't figure out where it was coming from. So we thought, let's use some THC and CBD. So instead of getting the prescription, which felt like a lot of trouble for her because it was, you know, you register online and then the online pharmacy calls you and then you go through this process and then they ship it to you. So I think it's really easy and discreet. I go on my phone, I log in, I pick my product, and it shows up at my door in a little box. I don't have to walk into a dispensary. And you know, I grew up with this thing being illegal, so I still have that little thing about it, right? So anyway, she comes in with a little bottle of THC and she says, this stuff does not work. And I said, how can it not work? It looks like the right thing. It had the same label, you know, and it had THC, and I could see it was an indica strain, and it was 2 milligrams per capsule. So that's almost a 0.1 mil, which for anyone other than a child would have zero effect. Okay, and so she was taking something, but you see, a bud tender is what they're called. They're not allowed to give you medical guidance. They are legally not allowed to tell you this might work better for your pain and this product might work better for your anxiety and this concentration is too low, so you need to, they cannot give you dosing and they cannot give you medical guidance. So they can tell you which one gives you more sex drive compared to creativity. Yes, I once did a talk called Cannabis in the Bedroom. So we'll maybe have to do that as a webinar too. That being said, I so digressed and I'm flat out of time. I'm so sorry, you all. For travel in Canada with your prescription, it is fine. There's no reason to start and stop. And even if you do stop it or forget it or whatever, you will be fine for up to 3 weeks without any, because it takes time for it to wear out from your body. I went to South Africa in December and January, and I was without for 3 weeks. And really, I didn't sleep as well in the last week as I did before I left, but there's no withdrawal, no change in how you feel. There's none of that. If you're traveling to the United States, I have no idea. I have no idea what you say on your form, what you do. That would be talking to a lawyer, talking to border control, looking into the details and the legislation that each country has. I had a patient traveling to London. No, you cannot travel with it internationally. Patients don't seem to think that the US is international travel because we're all one continent, but I would say you need to do your due diligence, you need to do your research, and you need to find out. Suffice to say that most people I know don't go traveling for longer than 2 or 3 weeks at a time. So we've had no issues. For my patients that live part-time in different countries, if it's legal there, I just have them buy it while they're there. So I have a patient that goes to Los Angeles all the time. Her daughter lives there. So she just pops by and buys. She knows now what works best for her, and she buys what she needs while she's there, leaves it behind, and then comes back home. Okay, I'm sorry, I'm going to take a little longer. Pregnancy and lactation, yes. If you are breastfeeding or you're pregnant, do not use medical marijuana. If you're under 18 years old, do not use medical marijuana. If you have schizophrenia or any kind of psychotic illness, you may not use THC, but CBD is okay. THC, there's a theoretical risk of it making your, and angina is where you get chest pain after exertion and you've got some blockage in your heart vessels. So THC can raise your pulse rate or drop your blood pressure. So for you, when we book our, and I do virtual consulting all over the world for functional medicine, I'm happy to book a consultation with you to discuss medical marijuana and whether it's a fit for you or not. But if you have heart disease, we're going to have to chat about it. Now, I did have someone I know lower his blood pressure with using medical marijuana. But again, he didn't have angina. So I'll say that I have seen it work well to lower blood pressure without medication. And then no smoking, ever, ever, ever. I don't approve of smoking. One of the licensed producers that I really like and trust because they produce such a good quality product, they're coming out with a vape that meets all the criteria for safety. And it's not going to cause oxidative stress. It's not going to increase free radicals in your body. If that becomes available shortly, I will hopefully be able to let you know. But when that's available, that's what I would recommend. But I don't recommend smoking a joint or anything like that. Why is this empty? Oh. So here are some of the symptoms it helps with, and I've mentioned sleep, I've mentioned pain, headaches, and migraines. Neuropathic pain, that's a very painful situation where people have nerve pain after diabetes or other types of issues. Sometimes it's a genetic issue, it's a medical problem, or it's a complication of a disease you have. Coping with trauma and depression and anxiety, as I mentioned. It's great for all of these things and more. So inflammation, muscle spasm, seizures, weakness and exhaustion. I've seen it help some patients with energy. Again, strain dependent, and we'll talk about that. And we've talked about all of this. So post-traumatic stress disorder, anxiety, depression, bipolar disorder, nausea, pain management, appetite and sleep, tumor regression, so in the field of oncology, sleep disorders, diabetes, addictions. So this is a little bit complicated. I wish I hadn't had that in there. In theory, we can help you with addictions by using marijuana. We're not replacing an addiction though, okay? That's not what it is. But in particular, it is hugely useful to lower the addiction to opioids. And we have a protocol that we can use and follow very slowly and wean down the opioid as we improve your pain control. Cramping, tinnitus is ringing in the ears, acne, and maybe in weight loss. My theory is, so I have a whole weight loss program and practice, and we get great results. One of the big obstacles to weight loss is inflammation. I have to say that. So, I'm not sure if how it works through brain chemistry, it works through inflammation. However it works, I have seen patients where they're doing everything the way I've taught them. And again, not everyone's going to get the same results from everything, right? And so we work through excluding and trial and error with patients. So we'll try a certain level of carbs, we'll try a certain type of diet or whatever. But here's a patient who's doing everything right and nothing's working. And then I write her some medical marijuana and everything falls into place and she starts getting amazing results. And then here, vaporized, you can see the onset of action, the peak of action, and the duration of effect, right? So edibles, this is where I said your gummies, your cookies, your brownies, your cakes, your butter, 30 minutes to 2 hours. Again, also it's dependent on how is it prepared, what is it prepared with, and all of those things. But it peaks 2 to 4 hours later. And how long does it last? 8 to 12 hours. Oils, this is my favorite. It's in the middle. This is the only thing I prescribe. And yes, sometimes I write herb as well. Sorry, it's called flower. But the oils take 60 to 90 minutes. For me, it takes 2 hours. Of course it would. I'd be slower to respond, right? It peaks in 2 hours, so 2 to 2.5 hours. And then it lasts 6 to 8 hours, which is perfect for a good night's sleep. Right? Vaporized, very quick. So a lot of use of vapors in patients with chronic pain. So they take an oil for the longer duration of action twice a day, and then they use vaporized, which I said I'm not fond of, but sometimes it's necessary because it works fast. So if you have pain, you want it now, right? And so you can get results within 5 minutes. Peaks in 10 to 30 minutes and lasts 4 hours. So, you can do the slow, and what we do with opioids, right? We give you a slow release one, and then we give you quicker acting ones for in between. So start low and go slow. Oh, that went by too fast. That's it. Okay. So the source comes from what we call licensed producers, and there are certain regulations that have to be met to be producing medical marijuana. And these standards are much higher than for recreational marijuana. So usually what will happen is that somebody is producing it, growing it in that type of facility I showed you. They go through all of the steps, all the checks and balances. The highest potency and the highest quality stuff is reserved for medical first, always in Canada. The rest of it can be used, if it meets the criteria, for recreational. What I like about dealing with medical is it's precise. I know exactly what's in it. I know how much. I've used it enough. I can work with patients with this. I'm not sure of all the products in a dispensary, to be honest with you. And why would you want to pay almost double, 30, 40, 50% more in a dispensary without the medical quality and standard, right? So, and it's tax deductible in Canada. So as a medical prescription, you get this back on your taxes. And that's what I said, it's more affordable. So I'm 12 minutes over and I apologize. How do you get a consultation or a prescription? I have no time for questions. So let's just say proceed by, let's book a consultation. It's covered by your healthcare. You want a prescription, you have to pay the licensed producer. Like this is a medicine, right? So you all buy medicines. Some of you have benefits that will cover this, and some of you are going to pay for it just like you pay for your blood pressure pill, okay? So here's the email, clientcare@betterforlife.ca, and the 4 is the numerical 4. So clientcare@betterforlife.ca, or better yet, give us a phone call at 403-237-2353. Thank you all so much for your attention today. Thank you for signing in and joining me, and I hope to hear from you and help you to get some of the amazing benefits that are possible. Well, all of the benefits that are possible with medical marijuana, the miracle from nature. I'm Dr. Natasha Iyer, and thank you again.